And I'm over here with Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. Welcome back to the show, buddy. Nice to see you again.
You too.
I want to talk to you about how is it possible that Georgetown Bariatrics and Advanced Surgical Services is the leader in robotic bariatric surgeries, not just here in the state of Kentucky, but also the nation?
Well, you know, I think we strive and put a lot of effort into giving the best for our patients, and it comes with a lot of good people and a lot of hard work. You know, we do more robotic, bariatric, and even general surgery for that matter than anybody in the state of Kentucky, and we're one of the top performers in the country. But, you know, I think at the end of the day, when you talk about surgery, people want to know two things. What's your volume and what's your outcomes?
Do people ask you that?
Absolutely.
They want to know.
Our patients are very well educated. They research this for years sometimes before we see them. And they want to know, like, do you do a lot of these surgeries? And how do your patients do? And one by itself is not sufficient. You need them both together.
Why is it so important that your before care, so when I say that to you, Dr. Eric, you have online seminars, they're also meeting with your team behind the scenes for months before the surgery, right?
Yeah.
Why is that key to your success?
Well, that actually has a direct correlation with outcomes. We tell people all the time that complications most of the time are due to lack of education and not necessarily due to something happening in the operating room. If we don't employ them with the materials of how to do the right things, how to stay out of trouble around surgery time, how to stay hydrated, then they're going to be more prone to having complications.
I understand. I want to ask you, I know it's a broad question, but what excludes someone from having this type of surgery? Health conditions.
It is a broad question for 3 minutes, but you know, for the most part, there's very few health issues that would tell us or make me think that we couldn't offer them surgery. In fact, many times that's the reason we should offer them surgery.
Really?
Because most of those health conditions can be improved by reducing their weight. And so the benefits of having the surgery far outweigh those risks of the surgery itself, and they significantly outweigh the risks of keeping those medical problems for the rest of their life, which will shorten their life.
And one of the best things that you and I have been doing this for many years, and that they get off their medications.
Right.
And that's key.
Yeah,
it's
absolutely.
not the most important thing, but it's a major fact.
Our job is to remove the comorbidities that shorten their life, and that's what we're doing.
Okay, I want to talk a little bit about the aftercare, especially when it comes to the physical activity. How much can they do very shortly after the procedure, and where do they lead up to?
Yeah, I mean, they're on 10-pound weight restriction for a couple weeks, and after that, they're essentially restriction-free. We teach them from day one what exercise means, what it is. We teach them how to use a heart rate monitor to monitor their exercise and if it's productive. And we work with other fitness instructors to give them something that anybody can do to be active and work towards those larger goals.
And even if it's just sitting in the chair to begin with, it's something.
Yeah, body weight exercises, things where it's just simple resistance against a wall, we can show them how to do that.
That's the important thing. Dr. Eric, always great information.
Yeah.
We appreciate you. If you want to find out more information, there it all is up on the screen for you. Georgetown Bariatrics and Advanced Surgical Services.